psychiatrist. Right now, I am working at Shepherd Pratt. I see that at least I have two colleagues here from there. So I'll pass it to Tori.
Hi, I'm Tori DeLucia. I'm one of Afifa's colleagues, very lucky to have her. I run the trauma disorders unit at Shepherd Pratt, which is actually an adult unit. And I just started working on a residential treatment center life launch, which is a kind of private pay facility that does some diagnostic testing and helps with kind of figuring out what's going on in complicated cases in kids. I also have a small private practice where I focus on human trafficking, asylee and refugee mental health, and I do some forensic interviews as well for the Department of Defense. I am the president of the Maryland Regional Council of Child and Adolescent Psychiatry, and I serve on the Victim Services Committee for the Maryland Human Trafficking Task Force. Nice to meet you all.
Dr. Wilson, do you want to go next?
Sure. Hi, everybody. I'm Cindy Wilson. I'm the medical director of the inpatient adolescent unit at Yale. And I'm currently the president of the Connecticut AAPI chapter. It's nice to see everybody.
Welcome. Siva, do you want to go next?
Sure. I think I might be the only Midwesterner here, although I spent a lot of time on the East Coast. I'm Siba, and I'm a child and adolescent psychiatrist at the University of Chicago. I'm the medical director of their eating disorders program and a co-director of our REACT trauma program. And I do research and health services focusing on diverse Asian American communities. And I'm excited to be here.
Thank you. Liana, do you want to go next?
Yeah, hi everyone, I'm Leana. I'm actually a first-year student at the New York College of Podiatric Medicine here in Manhattan, so kind of with a different background, but I know Dr. Adiba through my parents, and she brought this opportunity to me, so I was really excited to join, and it's really nice to see everybody.
Welcome. Dr. Ishak, do you want to go next?
Hi, I'm Dr. Tanvin Isaac. I'm a physician scientist. I am working at NYU Langone Transplant Institute, and I work mainly with the equity in access to care and then outcome research. And I am very excited to join with you all to address this important topic today.
Wonderful. Ron, do you want to go next?
Sure. Hi, I'm Ron Lee. I'm also a child psychiatrist over at Shepherd Pratt. Work mostly on the inpatient setting with the adolescent male. So happy to join.
Yeah, it's good to see you here. I'm gonna go now by first name. Rishabh, am I saying it right?
Yes. Hi, Dr. Diva. I'm Rishabh. I'm a third-year med student at Medical College of Georgia in Augusta. And I'll be applying into psych this fall, and I found out about this through the AAPI listserv. So thanks.
Wonderful, welcome. Happy to have you, David.
Hi.
Hi.
Hi. Sorry. I just got on. I'm assuming we're introducing ourselves.
Right.
Okay. Yeah. I guess I'm a PGY3. I just also got this email from the listserv as well. So I'm here
Wonderful.
just to be part of this.
Welcome. Shreya, right?
Hi, everyone. I'm a PGY2 at BI in Boston. Also got this forwarded from Dr. Sharma, who's over at Tufts. So excited to be here.
Okay, wonderful. He's a really good friend. So Rafin.
Yeah, hey everyone. My name is Rafin. A little bit of a different background. I actually work in cybersecurity. And this was a topic that definitely interested me a lot and thought it'd be good to join. I feel like this is something that isn't talked about in our communities as a South Asian. And I think you guys are doing great for this, just tuning in here.
Wonderful, welcome. Roxana. I think maybe she's in the background. So Roxana is one of our staff from the Maryland chapter. She's the one who actually helped us organize this event and send you guys all invite. Oh, here she is. So I will move to the next person, Sumaya, right?
Hi, yeah, my name is Samaya. Sorry, I'm talking a little quietly. I'm in the school library right now. But yeah, I'm just glad to be here. I really do think these things should be spoken more about, and I'm just really excited to hear your thoughts on the whole trauma and all of that. So thank you guys.
Yeah, Swati.
Oh, sorry. Hi, are you able to hear me?
Yeah, we can hear you.
Okay, thank you. Sometimes my mic is weird. Hi, I'm Swati. I'm a first-year med student at Penn State Hershey.
Welcome. Mary.
Oh, hi, I'm Mary Cutler. I'm a child psychiatrist at the Children's Guild.
Okay, wonderful. Welcome. Thank you. So we have, okay, Madhvi.
Hi, are you guys able to hear me?
Yes.
Okay. Hi, I'm Madhvi. I'm actually one of Leona's good friends, and she recommended me to join this. But I'm actually from the Boston area and the School of Public Health, and I'm really passionate about South Asian mental health. So I'm really excited to be here.
Wonderful. Thank you. Michael.
Hi, my name is Michael Chen. I'm a child psychiatrist. I used to practice in Connecticut, but now I'm out in by Guam in the Pacific, working as a child psychiatrist.
Thank you. Welcome. Rabia. Okay, I'll go to the next person, Ivy. Okay. We have a couple more people also joining. We'll come back to this introduction later on in our group discussion. As it's already 6:40. Dr. Wilson, do you mind starting?
Yeah, welcome everybody. Thank you everybody who joined, especially the students and people not involved in psychiatry. That's really awesome. So this presentation is about AAPI healing and trauma. And it is through the use of theater. We did a part 1 back in November. So this is part 2. And this was part of a AAPI collaboration grant between the Maryland and the Connecticut chapters, which is really awesome, and has been developed by Drs. Afifa Adiba and Eunice Yoon. So it is really, really exciting. And I think it's a super important topic, and I'm glad that there's been so much interest in it.
Thank you, Dr. Wilson. So I will share my screen. It's pretty informal. We don't want to make it very formal. We want to create a safe space for everyone so that all of us can talk. So let me see if I can do this. Yes. So as you see, okay. So there are a lot of organizations involved in this grant. Of course, AAPI, who gave us this grant, then Connecticut, and we have the president, Dr. Wilson from Connecticut chapter, and we have Dr. DeLucia from the Maryland chapter, and then me and Dr. Eunice, who started this, actually, who got this grant, we both work at Yale New Haven Hospital and also Yale Child Study Center. We both were trained there. Unfortunately, Dr. Eunice couldn't join. She's out of the country, but she sends her love and regards for all of you guys. And I will show you her picture. It's very important to know her. She has been doing this work for a long time. And I got a lot of support from Shepherd Pratt while I was doing this or writing for this grant. So of course, all of the organization are here. So here's the agenda. We already passed some time, so I'll go quickly through it. So first of all, we'll talk a little bit about this grad and how did we come together and where is the inspiration coming from, and then we'll show the video, and after that we'll have a panel discussion. We have I will talk about our panelists, and then we'll have a large group discussion, and then at the end we'll share some resources, and there will be a poll just asking if you like this program, do you want to see this type of program in future, and what are the topics we should cover. So I definitely have to read this. This is the disclaimer. The goal of this discussion is not to offer professional medical advice or political platform, but to serve as a healing space for discussion and to increase mental health awareness. Any immediate concern regarding professional health, safety, well-being should be appropriately directed toward their mental health provider or the primary care doctor. So please change your name on Zoom to anonymous if you would feel like more comfortable. And of course, if you have any question, if you don't want to ask the question, put the question in the chat box. We'll address that, or we'll answer that question to our best ability. Okay, so this is me. I look good in my picture. Yes, I do. Not in person. A little bit about me. I was born and raised in Bangladesh. I came here after I did my medical school over there. Then I came here and I did my residency with University of Mississippi. I was a chief resident there, and then I went to Yale and did my child psychiatry fellowship there. And I have been involved with organized medicine for a long time. I am involved with AAPI, AMA, and APA. I hold different I have different roles in this different organization. To do this thing, actually, of course, I'm South Asian. I'm very interested in South Asian mental health and how I have seen in my family people suffering from mental health and not talking about that. So this is where I got my inspiration to kind of like work for this population. This is Dr. Eunice Yuen, who couldn't join. She's an associate professor of psychiatry at Yale School of Medicine. Actually, we both trained together. We graduated together. She stayed there, and I moved out and came to Shepherd Pratt. She is the one who built Chat Together. Please, I will share the link with you guys. Please look. They have a lot of videos about this type of topics, especially focusing on East Asian population. So it's Chat Together is compassionate home action together. So she is the founder and director of Chat Together. So now a little bit, I don't want to make things very complicated. Just want to talk a little bit about immigration and immigrant population. So when anyone immigrate from anywhere, there are process of adaptation, and there are two processes. One is acculturation, one is inculturation. Acculturation means they adopt to the foreign culture where they have come, and inculturation means that they keep some of their tradition where they are from, the host culture, and the mixture of both called adaptation. There are different models for acculturation. This is the one. Is if you see there is four corner: assimilation, integration, separation, and marginalization. Assimilation means that I'm totally into the foreign culture. I don't have any sense of my own culture. Separation means that I'm totally into my own culture. I didn't want it to be part of this foreign culture where I came. Marginalization means like I am nowhere. Integration means I have submerged. So as you see, here is the maintenance of heritage, and here is the cultural adaptation. So you want to have both mix of separation and assimilation both, if you want to have good adaptation. So here it is, and this is something actually culture informed care for AAPI population. So cultural adaptation, family center approach, acculturation, stress of migration, transgenerational trauma, racism, microaggression. These are all the things we are trying to cover through media. this is our panelist. I'm gonna talk a little bit about each of every person because this is about people and each and every person is very unique here and very special. And I really am grateful for them to join to this project and working with me, and it's been wonderful. So you already know Dr. DeLucia. She wanted to be, highlight of the thing is that she wanted to be a award-winning opera singer. However, ended up becoming a wonderful child psychiatrist, and I'm happy about that. And she actually did her residency and child psychiatry fellowship at University of Maryland. She wears several hats a day. She's our service chief for trauma disorder unit. She was our consultant for Life Launch. It's a residential. She also worked for Maryland Human Trafficking Task Force victims. She's the president of Maryland Regional Council General Psychiatry, and she's also an adjunct assistant professor at University of Maryland. She is a wonderful mother, and she has an adorable 18-month-old daughter. Oh my God, you want to eat her alive. This is Layana Kabir. Layana is a first-year student at New York School of Podiatric Medicine. She was born in Bangladesh, but she came here very early age when she was very young. She was raised in United States. She was in New York and then came to Maryland. She did most of her schooling here. She has 2 other siblings and a wonderful family. This is Dr. Siva Anam, one of my dearest colleague. So she's an associate professor at University of Chicago, Department of Psychiatry and Behavioral Neuroscience. Her research and clinical efforts are examining the impact of cultural factors on mental health, health equity, and social determinants of health. Her recent efforts focus on the utility of media to address mental health needs in underrepresented communities, especially related to trauma and health services. He is the founding member of University of Chicago Global Mental Health Initiative and has served as a research investigator and advisor for the University of Chicago Center for Asian Health Equity. So she will today talk about a little bit about the clinical implication of this kind of program. Now we have Dr. Tanvin Ishak. I know her through my husband. They went, as I said before, they went to the same institute. Wonderful friend of mine, and very accomplished and very dear person. So she is a physician scientist. She was born and raised in Bangladesh. She did her medical school there, one of the top medical school in Bangladesh, and then she came here at Johns Hopkins to do her master's in public health, and then right now she's working at NYU. She's working at Langone Transplant Institute to explore existing geographic, social, and allocation disparities in transplant waitlist. So very important work. She's one of our actors today in this skit. You will see her there. Now we are going to share the let me stop sharing. How do I stop sharing? Okay, yes, here. So now Roxana will share the video we made. So let me tell a little bit about the video. So it is about this is actually a real story. I got this from one of my South Asian patients. She was originally from Pakistan. She had a very conservative family, and she was born and raised here, so she wanted to date, which was forbidden in her family. So this is the conflict, and first of all, first part you will see the conflict, and then you will see the psychiatrist, how they moderate and then they talk and how to communicate, give them some tools, and after that we will see the version 2. So without further ado, Roxana, do you mind sharing?
Jasmine, where did you go yesterday evening?
I went to my friend's house.
Which friend?
You know her. Her name is Molly. She came to our house last month.
Why didn't you answer my phone when I called you last
You were
night?
watching TV.
Why are you lying?
Why do you think I'm lying?
Because I saw you last night. A boy dropped you at home.
That's my friend. He was also at Molly's house and he dropped me home because it was late at night.
You are lying again. Why would you do such things? You know we don't date in our family. Why don't you don't have any respect for our family rule? You are bringing shame to our family. How will we show our face to this community? I can't even believe that you are my daughter.
Mom, what are you saying? I'm 17 years old. I'm not a child anymore. If I want to live my life the way I want, I don't need your permission. If I want to date, I can date.
You will do what we say. If we say you are not allowed to date, you are not. Your father will be very disappointed at you.
All my friends are dating. I don't need your permission.
We will see how you date. Look at your sister. She never dated.
Here we go again. I'm not my sister. I will do as I please.
Then you are not allowed to go out. You are grounded. I will take your phone away.
You can't do that. I'm not a child anymore.
Yes, you are. You will do what I want as long as you live under our roof. I'm ashamed of you. I pray that no one knows about this. I don't know what we will tell people.
Is this all you care about? You care more about what people think than you care about me.
Did you have physical relationship?
I'm not going to answer that.
Oh my God, you are not virgin anymore. I can't even believe that you are my daughter. What will we do now?
You are making a big deal out of nothing. Mom, I am 17 and I have a right to date.
No, you don't. I didn't date. I had an arranged marriage. I was a virgin until I got married to your father. You are bringing shame to this family. You are being selfish and you are only thinking about yourself. Let me tell you that he will leave you now as he already got what he wants.
You don't know what you're talking about. You should have taught us about intimate relationships. We're not. You expect us to be perfect, but I'm only a human being. You like to see a fault in me in everything, but you don't see your own faults. All you care about is what other people think. You care about the other people, the relatives who we barely see or know, and then the community.
You are being very disrespectful right now. You are grounded. I am taking away your phone. You are not going to step outside of this house without my permission. And I am going to decide later what to do with this nasty relationship of yours.
What are you worried about? What are the alternative ways to express your worries?
I am worried about her safety. I worry that people will take advantage of her. I worry that she will take a wrong decision, then people will judge her and spread rumors about her.
Okay, so it seems like you are worried about her safety and reputation.
Yes.
So Jasmine, what do you think went wrong with that conversation? What made you so upset?
I feel like I have no privacy or freedom, like I can't be trusted, and no one cares about my feelings.
Okay, so it seems like you don't feel validated. Is there any other way you can think of expressing your feelings?
I try to express my feelings to her, but I don't think I can get through to her.
What about Mom?
I feel disconnected from her. I don't know what's going on in her life.
It seems like there have been some communication issue. Mom feels like she needs to look into your notebook to know about your life. And you feel like you cannot communicate with Mom because Mom might not understand. So let's try to communicate more.
I'm sorry that I looked into your notebook, but I want to know your whereabouts and I want to know what's going on in your life.
I understand your concerns and I would appreciate sharing more with you, but I want to share without feeling judged.
So it seems like there are some cultural gaps between you and your mom regarding your relationship with your boyfriend. So Mom, what is the most concerning thing for you in this relationship?
I never dated. I never had a premarital relationship. These things are scary for me. She is a young and beautiful girl. I want a bright future for her. I want her to be successful in her life.
So it seems like Mom wants you to be successful and not make any mistake that you might regret later in your life.
I didn't realize she's this worried. I just felt like I had no freedom. All my other friends were dating, so I just wanted to do the same. I guess I didn't understand that because we're from a different culture. It's hard for my family to accept this, but I just wanted some companionship. My life can't just be about my studies. I also struggle with the fact that we never had an open conversation about intimate relationships. I want to have more open conversations about that.
It often happens that parents find it difficult to have a open conversation about intimate relationship. Then children try to go outsource those information from different sources, which could be dangerous and lead to unsafe sexual behavior. It is helpful to have developmentally appropriate conversation with your children about romantic relationship, intimate relationship, and safe sexual behaviors. This could help creating an opportunity to connect with your children so that they can be open with you, so they can feel safe talking about their emotion with you, and they can ask for guidance when needed. I realize that not talking about physical relationship will make our children more vulnerable. I'm also trying to understand that she is born and raised in USA, so her upbringing will require a different parenting style than mine. Okay. Jasmine, where did you go last evening?
Oh, I went to my friend's house.
Which friend?
You know her, her name's Molly. She came to our house last month.
Why didn't you receive my call last evening?
Oh, we were watching TV, I didn't see it.
Is there anything that you are not telling me?
What makes you say that?
I know I'm hard on you, and you might think that you cannot share things with me because I will not understand.
I do feel that sometimes.
I saw a boy dropping you off last night. Can you tell me about him?
Yeah, he's a friend of mine who's also at Molly's. He dropped me because it was late.
Okay. Is this boy more than a friend?
Yes, he's more than a friend.
Are you guys dating? I want you to come to me about this kind of stuff.
We have been seeing each other for the last couple of months.
Are there others?
No.
How close are you with him?
We just started seeing each other. We just like each other's company, that's all.
I would appreciate if you are honest with me.
I am being honest with you. You have to trust me.
I want to trust you, but I was at your age once. In this age, people make mistakes sometimes. They take decisions that they regret later in their life. I want you to be very careful.
There is nothing else going on between us. You have to trust me.
I can trust you, but I don't know the boy. You know, being from a different culture, we are not very familiar with this type of relationship. I'm worried that you might get hurt.
Would you feel more comfortable if I told you more about him?
I will worry less if you are open to me. I'm always worried about you and our family's reputation. I want you to consider about our family values and traditions.
I'm not going to do anything that will destroy our family's reputation.
I know that you don't want that. Still, you are very young, and sometimes a young girl like you can get influenced by others, and people can take advantage of a young girl like you. I want you to know that the world out there can be very scary.
I know you're worried, but I'm 17 now, and I'm going to be an adult very soon. Sometimes I want to make some of my own decisions and learn from my own mistakes.
I want you to do that, but I also want to make sure that you have all the information you need. I also want to share some guidance whenever you need me. You can always rely on your parents.
Thanks, Mom. I'll reach out to you when it's time, but does this mean you're okay with me dating?
I'm not totally okay with this. I will always have my struggle and conservations. But I understand that you are from different era and I cannot raise you the way I was raised. So I will always try to support you, guide you, and help you to make better choices.
Thank you. I'll try to be more open with you as well and try to understand your perspective too.
Wow, that was really beautifully depicted. Thank you so much to the actors who were performing in that skit. Were there any questions or comments? No, it was so well done, which is true.
I thought it was, yeah. So I'm a Bangladeshi child psychiatrist, so it's like cool to see people in the space. So thank you guys. Very impressive that you guys handled it in a session. I don't know if that would totally happen in real life with all this stuff, but it was great to see the balance of each perspective taking, just reflecting like personally and professionally. There's a lot and there's so much social judgment, I think, that comes up that, and it's so entrenched if they live with extended families or their community is so like individualistic Western society versus communal South Asian society, it's hard to reconcile and grapple and assimilate. I think each family, each individual is so different. So definitely challenging. But great job.
Dr. Ishak, did you want to say something about being a part of this?
I am originally from Bangladesh and I moved here for my master's. And when I moved here, I found the culture and norms are like very different from my country to USA. So my personal experience of facing that cultural dilemma made me concerned about the project that this project addressed. And so that's why when Adiba told me to participate in this video, I was very interested, and we were actually very excited to do this. And yeah, so when I was doing this skit, I was not feeling at all comfortable because I had to like talk so rudely with a young girl of her age. But at that time, I felt that like what's like for the immigrant people who came from a like different culture, like they also have to have their like own struggle. They have their own struggle to balance between their Western and Asian culture. They have a struggle to ensure their like acceptance or approval in their like immigrant society. So sometimes it come across that they are so concerned about these like societal norms that they don't understand what their kids are like going through. And and because the parents and kids like cannot talk about the relationship issues like openly, so immigrant parents don't understand like what's their kids are like going through.
Yeah, I think that's a really good point. I would just like to speak to the universality of this scenario, even though it is focused on AAPI populations. I myself am an immigrant adopted to 2 Italian immigrants, and we would have the exact same scenario played out in our home. And I think that it's really interesting to consider, you know, what I think that the idea of immigration, there's an extra standard placed upon ourselves in terms of proving that we are worthy, that we are American enough.
Yeah.
And that we should hold our children to this impeccable standard so that we can also feel like we're actually integrating, even though it may not have anything to do with that. And as teenagers, the feeling is, yeah, we have to integrate, and integrating looks like this. So the conflict, I think, was really nicely depicted in that, you know, parents are struggling to have an ideal child in some ways, and the child is struggling to have a normative adolescent experience. And those things are in stark contrast with each other, even though it's the exact same system that the family is working in.
Yeah, I totally agree with you. And for the young girls, it seemed that they are living in 2 cultures at the same time. Their family norms don't match with their like societal norms, and then they cannot explain their family situation to their friends, and then they don't get any psychological support from their families because their parents don't understand the societal norms here. So we really need to be very careful with this like young populations, young groups of kids, because they are going through a very vulnerable situation.
Liana, as you were there, being raised in USA and then being the second generation, how was that for you? And what do you think about that?
Yeah, so I think first of all, thank you for having me be a part of this, because when you brought this up to me, honestly, my friends and I, we talk about it all the time, our generation, there's a big generational gap with our parents and the generation before us. And it was really refreshing to see that there is at least something happening in the works in terms of awareness and having more open conversations about it. The video itself I never had I had similar situations with my parents, right? Growing up, I think, but I think it starts from a very young age as well, not even just about sexual health or anything, but there are so many different parts to trying to get validation from your South Asian parents. They have certain expectations from you. We can go through my whole life story, but that would take a while. We'd be here all night. But I would say that coming here early on, when I was in high school, it was a different experience of trying to assimilate and integrate, and versus now how I kind of approach it. Because when you're younger, at least for me, when I was younger, I wasn't really confident in my Bangladeshi, South Asian culture. I sort of hid that part of me and kind of neglected that part of my identity, even though it was such a big part of my home life. So when Dr. Ishaq brought up, living these two different worlds, it's very, very common. I feel like I still kind of deal with that. I think over the years, things have gotten better because it really doesn't matter what environment you're placed in, who you surround yourself with. So I know in high school, it was hard for me to assimilate because of my area. It was hard for me to adjust to both cultures because of, in high school, I went to a majority, it was more upper middle class socioeconomic status families living in this area. And so there wasn't as much diversity. And if there was any sort of diversity, they also didn't identify with their culture either or embrace it. But then when I went to college, there was a lot more, diversity, international students, it became cool to have a culture. So that gave me a lot of confidence, I'll say, the people that I surrounded myself with later on, because I think growing up, we all deal with our own set of insecurities. So in college, that was more when I found some confidence in being able to share parts of my identity as a Bangladeshi American to my non-Asian friends or whoever I came into contact with. But and that confidence translated to my home environment as well. So I was able to open up to my parents more about the things that I was doing, who I was with. I wasn't really trying to lead two lives because as much, not obviously nobody's perfect, but there was a lot that I had to work through with my parents, and we still are. I think for me, it was more so I saw growing up when we immigrated here, I was younger. So I saw a lot of, the obstacles immigrant families, deal with trying to, establish themselves and settle here in America. So seeing that firsthand with my family, I guess I was mature enough to understand that, they had certain expectations from me. And I think that also plays a role in how I view myself, because I'm also the eldest daughter. So that comes with another set of responsibilities. And these are conversations that I've had with countless other people, in my age group, in my generation. To some degree, everyone feels this way. And it is more universal. It's not just South Asians. It's any foreign immigrant family and person. So, it's mainly about the best way I could describe it is I was thinking about it, how in 5th grade for science class, we would make those bridges, and those bridges would be so very non-stable, unstable bridges. And that's kind of how I felt growing up. Like I felt like I had two sides that I kept like needing to balance. And it's very like talking about like the things that I think Americans are more open about with your non-American or like, you know, immigrant family. It's very taboo, especially like the conversation or the scenario that we had in the video, very, very taboo situation. But I think, or topic, I mean, but I think we have made progress over the years. Our generation definitely isn't one to like stay quiet. So it was nice to like be a part of this because all of you, like everyone said parts about, you know, like this is something that needs to be talked about because it does affect, I know it's affected my mental health and my development, the way I grew up, how I handle my situations now. Like there are so many situations that I deal with now, even with my parents or with friends, that I handle very differently because, you know, growing up, I was so used to hiding things and, you know, trying to navigate and try to be everyone's, like be on everyone's good side, right? So yeah, this was a great experience. And even because actually this video was done at my house and my parents are actually there. So it was really interesting to see how they handled, you know, us like working on this and like me helping Dr. Adiba with this project because they're really supportive. And I see, like, I didn't expect that out of my parents, you know, because they're so traditional. But, you know, baby steps. So yeah.
Yeah, I want to share one thing when we are doing, so there are a lot of other things in the script. We kind of like talk about, and both of them were not feeling comfortable doing that. So we have changed a lot of even word. Like we changed virginity with intimate relationship. We changed sexual relation with, if you would notice, then we would do that because we're doing that in a South Asian household, this video, and the parents are there. They gave us a space. They went downstairs. They created the space, safe space for us to do. They're very, I feel like they helped us a lot. They supported this, but we are also being very careful what word we use, because if this is where to go to a South Asian family, if you show me to this, my mom, she's like, oh my God, what are you guys talking about? You are showing this kind of video? How can you do this thing? So my mom would freak out and then maybe pass out. So so I feel like that part of your parents are pretty cool. And I wanted to ask Dr. Anam, because I think Liana bring up really a good point about the conflict with your identity and how that affects the mental health, especially the South Asian mental health, when you're living to life, when you're having conflict with your family and also the outer world.
Sure. I'm happy to join in, but first of all, I wanted to thank the Maryland Council and the Connecticut Council for inviting me to this event. I think it's a really important topic and content area that doesn't get addressed as much. And it's personally meaningful to me as also a Bangladeshi and Bengali American child and adolescent psychiatrist. But I think one of the things that emerged is, you know, I think that this particular topic, I will say that even when I saw it, I was like, oh, wow, they're talking about really hot button topics, which I cannot imagine having these kind of conversations in my home in the ways that it was occurring and having it be resolved so quickly, right? So I think that, you know, one of the things that this conversation highlights to me is, and I think that a lot of the participants have already kind of identified the role of language. So I think kind of the language that's utilized in having conversations about kind of, you know, sensitive or conflict laden or emotional content is very critical, because I think if you start using language that, you know, is stigmatizing or kind of polarizing, it can shut down communication. So I think that consideration paid to the specific language that's employed in having, or in kind of even starting opening the door to conversations that are, you know, really, you know, kind of difficult or taboo to talk about is important. And I think that here we're focusing on kind of, you know, romantic or intimate relationships, but you can extend that further to even mental health, right? So there's so much silence about discussions about mental health and emotions. Sometimes if you bring up terms like I feel depressed, I feel anxious, even that can bring down shutting down of a conversation. Like, what do you mean you feel anxious, you feel depressed? What do you have to be anxious or depressed about? Or, like maybe if you have things like I feel stressed or I feel tension, that might go over well, that might open a door. So I think that consideration of the specific language that's employed or utilized can really facilitate communication that is complex. And I think that there's a general silence of kind of discussion about mental health or taboo topics in many families, and especially many immigrant families. So I think that kind of having another way to engage different generations along lines of discussion is important. I guess one of the things that came up that you maybe intentionally or inadvertently depicted is that you actually didn't have this conversation until there was through a verbal communication. That communication occurred by discovery of a diary or a notebook, right? So it wasn't that there was this ability to have this conversation. It was, I didn't know what was happening in your life. I was worried. I had to go sneaking around and looking at your phone or your notebook or whatever like the current iteration of your diary is. And then that's how the communication was facilitated. So you didn't start from a vantage point of like, let's talk together. It's kind of like a punishment, like you're in trouble, what happened? So I think that that's also something important to consider. Like if you want to have these conversations, starting from the point of how can we open up a line of communication rather than have to sneak around and kind of go through another kind of route of communication that can be kind of a discipline that can involve discipline rather than facilitating open lines of communication and vulnerability. I think those are important considerations. And I think you just did a beautiful job in depicting a not uncommon scenario, but one that's really hard to kind of navigate.
Yeah, so this was inspired by one of the program called Stanford Cheap Out. So Dr. Rana, who has been mentoring me, she tells me a good, wonderful thing. She said, Afifa, when you are writing this skit or when anyone is writing this skit, make sure that you don't give the mom a brain transplant because they are not going to change in a night or with one conversation. That's what we also wanted to show, that mom is still say when the daughter asked, like, are you okay with me dating? Mom said, no, actually, I'm not okay. I'm still going to have my conservation, but I would like to know if you need information, I'd like to provide you that. And I hope that conversation like this goes well after one, like Dr. Rahman was saying, that after one session, it goes well, because it's very uncommon, right? It doesn't go this way. Is there anyone else, like, what do you guys think? I wanted to hear from the audience. I mean, what, if you guys have any question, or what the thing you guys feel like could have been better in this skit, and does this thing relevant to you, and how do you see in your practice or in your personal life?
So I thought one thing that was depicted really beautifully actually is kind of the closing of the acculturation gap. I know with a lot of immigrant communities, a lot of the miscommunication between parents and the child are because, the child is kind of acculturating at a different rate than the parent is into that host community. And you can kind of see even after that first session, that gap is closing just a little bit. And even with that little bit of closure, the communication and the relationship is improving so much. And I thought that was depicted, really beautifully. One thing that I'm Nepali American, and one thing that I was thinking about throughout the whole skit was the gender role. And this is a mom with a mom. And I really wonder how the conversation would be between a mom and a son, or a dad and a son. Again, also an older daughter, part of a very large extended family with an older brother, and have myself witnessed very different dynamics because of gender roles. And obviously, that's a different topic in and of itself, but really interesting thought that just came up as I was watching that.
Yeah, what a wonderful idea. I mean, I am the eldest daughter. I have a brother, and the scenario is totally different. I could tell you that. Yeah, it was, the conversation was different, and I felt like the conversation happened with my mom. My dad never got involved with any one of those things. Like, he is somewhere else. He's a very involved father, don't get me wrong. He's a very involved and loving father, but not with this kind of conversation. No, I'm not having that conversation. But now I have a daughter. I would like my husband to have that kind of conversation with her if it is possible. What do you guys think? Like, what would it be if it was a mom or a son or a dad or a daughter?
Sure, yeah, thanks. I don't want to take up too much space, but I had the same thought. I think religiously, that's a whole nother topic to get into. And the cultural mask of, I don't know if they were Muslim in this, but like there's this line in the Quran that says like, children should not say anything to cause parents to say oof or like be disheartened. And like, oh, parents use that so much and so liberally. So like it's balancing that. And I wonder, what I was thinking of as well as like maybe intergenerational trauma as well, given that the Liberation War was in 1971, our parents they don't talk about it. Like extended family does not, like now I'm hearing about stuff that my grandparents and like extended family have gone through. So I just wonder how that informs ideas about intimacy, relationships. Yeah, it's just so much there that parents don't want to talk about and we don't want to even get into because it's like a boundary thing, but also we want to help understand kind of the parental, grandparental, intergenerational trauma that is affecting the relationship now between the parent and the kid. Yeah.
Yeah, I totally agree with you. I mean, in this kid, one time you have noticed like intentionally the mom was covering her head. It was a Muslim family, right? They are from, it is the original, the people who had this conversation is a Pakistani family. Of course, they are from Muslim background. And you would see that like mom would say, oh, I never had a premarital relationship. I never dated. And like, this is norm to me that my mom and dad or my family will decide someone that I will marry into, and then I will marry into that family or that person. And that's how you are going to do it. Because as you know, like in Islam or some religion, is premarital relationship is not accepted, it's forbidden, right? I think like that's another part we try to kind of portray that. But of course, we respect all the religion, but when we are talking about culturation, when we are immigrant, we are from Muslim family and coming into US where we have different religion, different background, people from different race and ethnicity. So when your kid is going to in those environment and then being there, how that if you're keeping this very tight, close rules and regulation at home, then how they are going to emerge into the society you brought them in. So I'm not saying that this is parents' fault, but I do agree with you. Maybe this is the transitional trauma or the transitional generational not trauma, then that some of the tradition where this is what I was raised, this is what I'm going to raise you because this is what I did and this was right. And this is what you will do because I feel like this is right.
And totally, I think the Instagram is great. I saw this one post where there was like the immigrant parents were in survival mode and then they came to kind of sacrifice in order to give their kids a better life. However, they're in a different culture too. And so now that the kids are settled, are stable financially and security wise, they're dealing with a whole different set of things totally foreign to their parents, and that they have the time and energy and effort to get into self-actualization and figure out like who they want to be in the world. And maybe the parents didn't have that luxury of doing that because they were literally trying to survive.
Is there anyone else? I see Sylvia here and then Ron. One of our another friend joined me. I'm just calling out names.
I am not Asian at all. I'm Argentinian, so my heritage is more Italian and French and Spanish. So, but I came here as an exchange student when I was 17 and stayed here for a year. And I became part of the family that had me as exchange student. And to the day, I'm still connected with everybody. We get together with my cousins and so on. But it was difficult. I always felt like I was the frog in the wrong pond everywhere, because I had taken so much in from the American culture that seemed to clash with my Argentinian friends and family, and vice versa. So, going to someone and giving them a hug, and people thought that was kind of weird because they don't touch it. Americans don't, and they're not touchy like that. So it was hard. My daughter I came with my daughter when she was 5.5. So she adapted very quickly. But I delight when I see her being proud about her Argentinian side of the story. Or when I see my son, who's totally American, having mate. It's like, oh, there's something in there that I was, that I value that they have that is mine. So, but our experience was very different. But I can see how people are very traditional and have a religion that does not allow dating until certain age. In some of the places, marriages are arranged, which to me is like crazy, but they work out a lot better than the marriages in here anyway. It's hard for them to think, well, yeah, this is how I was raised. This was good. It always worked out. But now you live in a different world. So how do you adapt that to still give all that wonderful richness that you have from your culture and yet let them adapt it to what happens here?
Yeah, I totally agree. And then wanted to kind of go back to what Dr. Anam was saying, that like the communication piece, right, is so important. And I sometimes wonder, like, it's right that so the topic that there was not an open conversation. Actually, mom found this diary or this phone, and then that's how she came to know. And so that means that mom didn't know what was going on in her life, and then she didn't feel comfortable sharing those things on mom because she felt like mom is going to judge her, because that's the sense she has, and then that's how she felt. So from child's side, there's not enough validation from mom's side that she doesn't want to listen to me.
I just wanted to add on to that too, is kind of extending out to kind of, a clinical setting, is that there's this distress associated with concealment, right? Like this child is having this life. And I think people here mentioned like having two different lives and not being able to, I think you nicely put it, be able to bridge the two. And that in and of itself is a source of stress and distress. And I think if you, as clinicians, if you, have patients that kind of come into your office that are kind of navigating these different set of social norms in the home, and they're kind of directly contradictory to the set of social norms with their peers, and, what's the right thing to do, and how do you fit in, and how do you fit in with one set of identities in one space and a different set of identities in another space, and having to conceal parts of yourself or kind of code switch a little bit from one situation to another, I think can be a tremendous source of distress. And that's just kind of day to day. So I think it's an important consideration. And I think if you're able to kind of open up some of those kind of lines of communication or share some of those identities, it can probably kind of relieve some of that stress that can contribute to, affective disturbances or kind of anxieties. And I think that that's an important consideration, this continuous compulsion to conceal in order to evade judgment in different settings. And that goes doubly if you're dealing with like the intersectional identities or any other identities that may not be recognized or accepted in different spaces.
I want to give other people a chance to talk, but I have so many thoughts. Dr. Anam, and I'm Jen, off the clock. I'm off duty right now. What was I thinking? Oh, somatization of, I think, mental health issues. I think I've heard of, so my parents are psychiatrists, and I think people feel comfortable asking them clinical questions. I'm like, please go to the right, like they want to help people, but it's like, but I think so much is expressed somatically because the vocabulary is not there to talk about it, or they haven't had the words to talk about it. And sometimes in expressing, like I've had friends of friends and family friends, like if there's something where the kid is struggling academically or emotionally, the parents feel it somatically, and then they express that to the kids in that, oh, like this thing happened, I want to end my life, I want to kill my, and then that stresses the kid out. And I'm like, oh, how do we backtrack from that? And how do we express that in an appropriate way but also not take it, get rid of that enmeshment quality. Like you want the best for your kid. Their success and failure in society's eyes should not be so pivotal to kind of family reputation, perception, worth. So yeah, it's just a lot of family work, I think, could be had with a lot of culture, not just South Asian, but cultural competency in general.
Hi. In terms of communication, I struggle with some of the less acculturated populations here in the Pacific, where they're first generation immigrants. They're coming to me. They're speaking some English, but then the more detailed material gets lost with the translator. How can I find good, especially in this case, things that are translated into Bangla? What can I find that's good mental health sites? Things like explain medications, things like explain somatization, depression. How do I explain these things? I can get when the translator's missing the point, and I ask them to try to rephrase it, can they get it right? Sometimes you have a teenager that gets it, but then you have to get a consent from the parent, and they don't see it as what is this mental health thing? This is not a disorder, you're fine. But how do finding translations for things, for scales? How do I find scales that are in multiple languages, that are in Bangla, that are in Bengali? How do I find educational materials? Do you guys have any suggestions or thoughts of good places to look?
So we have this International Child and Adolescent Psychiatry Academy, right? I think they call, if I'm not mistaken, Seva, they call ICACAP, right? Dr. Martin is the one who is trying to translate. He reached out to me at some point that he is trying to translate a lot of the thing. Like when you go to AAPI, right, you have this family for facts thing. So I think they have in different language. And I know that he was working someone from Bangladesh. From Bangladesh, I can tell because I was trained under him and he reached out to me. And he was working with a Bangladeshi child psychiatrist who is translating those things with him. So I don't know how much they have done so far, but that's a good site to look. And Siva also dropped something in the chat.
The strengths and difficulty questionnaire that's kind of well validated and used in multiple languages is available. But I think that part of what you're saying is that it's the language. Yes, there's a translation component, like just literally what languages are available. But I think some of the concepts and constructs are not necessarily easily translated, right? So the way that we talk about things and conceptualize things isn't necessarily the way, there's not a cognate kind of term in many languages. So I think that that's part of the difficulty here, is that our understanding of what mental health looks like varies very much from culture to culture. And so there's not a direct translation necessarily of the same concepts that you're trying to get across or assess. And I think that's part of where the work lies.
I would say I'm remembering a case on the inpatient unit where even medical to mental health translation and even the different dialects within a culture can differ so much. Like it was a suicidal kid. And then I was like, wait, no, you didn't translate that exactly how I wanted. So, and then that can affect the kid's self-esteem and image and kind of safety. So it's really important to have, and even like asylum cases, Spanish, I'm like, in my basic Spanish, that's not right. So having a standardizable kind of interpreter that can be reliable too is difficult for sure.
And sometimes what happened, like I find I have that struggle all the time, and I get a lot of Spanish speaking population in Maryland here, and like same as in Connecticut. So sometimes I do like in-person meeting with them, so that I can see their facial expression. Like I can see, I can explain them by, sometimes I have even drawn thing to kind of like tell them what to do and how to do this thing. Because I know that I could tell from their facial expression that what they're hearing, maybe that is not what I'm trying to say. And it's so true, right? Like right now, the language is really important. How do you explain things? How do you talk to the kids? So I feel like that's another part I think is important, if you can have one-to-one conversation with them and take a little bit extra time to kind of like provide the resources to the family. Yeah.
I had a quick comment. This is Dee. I really love the way, as the physician, you were able to, Afifa was able to join with both the kid and the mom. And I think that's critical. I remember being a fellow and having something similar in terms of a case in the inpatient unit. This was a Pakistani 17-year-old that was admitted because mom discovered that she was dating and was sexually active. And this was an extended family living situation. So mom proceeded to attempt suicide, and the girl called 911 to help save her mom and landed up on the inpatient unit because the extended family then said, "You've done this to your mom, you should kill yourself." And of course, DCF was involved, and it was, you know, this was Cambridge, Massachusetts. So the inpatient unit was like, what's the big deal? She was dating and she was sexually active. She's 17. And unfortunately, we had an attending from Bangladesh who explained that if this had happened in Pakistan, in their ethnic group, this kid would have been stoned to death. So, you know, having the ability to culturally connect, I mean, of course, joining in the family therapy sense, but also being able to convey some of the cultural context in different systems of care is definitely a challenge to extend from what Michael just said. And, you know, having videos like these to simplify those concepts and to show that it is possible to achieve. And, you know, extrapolate from some of the common issues that occur in both, you know, acculturation, but also as one of the speakers beautifully said, highlighted some of the struggles that the parents were having. I think it was Jennifer who was talking about, you know, we have the benefits of self-actualization, which our parents didn't have, right? So understanding where they're coming from, that's so very important. It's been a beautiful session. Thank you so much for doing this. I've really loved it so far.
Thank you for joining. I thought you were in your vacation, but thank you for joining. Anyone else? Dr. Wilson, Ron, anyone?
I am not of Asian background at all, but I was just struck by how some of these concepts are universal and can, like, you know, really give some tips for communication with families across many cultural backgrounds, especially those families which tend to be more like conservative or religious. Like my own family is extremely religious, and I could imagine having a very similar conversation when I was growing up. So it just struck me how much it could apply to just a lot of families.
I think I also want to point out for providers that I think it's very difficult to not have strong transference feelings in identifying either with the family or with the patient, and how hard it is to try to be a neutral party and say you have a point and you have a point because our feelings are just so strong, because one, the family dynamic is so polarized. You're wrong, no, you're wrong. And it's very difficult and painful to be in the middle of that, and speak with any coherency and trying to get a family to move together as a group rather than take a side and try to convince one of the other parties that they should behave either more traditionally or in a way that reflects more kind of quote unquote assimilated values.
I totally agree with you because I'm going to tell you a story. So when I was in Mississippi, here we had a South Asian male psychiatrist, wonderful psychiatrist, no doubt about that. One of my mentor and then supervisor. He is a little bit old school. And then there's a girl who came from South Asian family. The girl was bored because mom was putting pressure to do better at school. And she couldn't handle the pressure. So she tried to hurt herself and she was brought here. And the mom was crying, like, oh my God, I did this to her. And then all I asked her to do better. And then she doesn't understand. I'm putting a roof over her head. Her dad is working 2 jobs. So all those things, yada, yada, right? And then it's me, my friend, and the psychiatrist, all 3 of are sitting there because we are having a session. We do our outpatient like this. So I could, so when the mom left, the daughter and then my supervisor sitting there, I could totally see his counter transparent toward the mom was more positive than the daughter, and he was totally like invalidating. And then here I see my other friend who was born and raised in Canada, but was from a Muslim family, and kind of like feeling like toward the daughter, like, and at some point I felt very conflicted there. I felt like I want to be with the daughter because I have my own trauma talking about like that could take several hours. I feel like growing up, I felt that pressure that I have to do good, I have to do better. And then like, I feel like sometimes our parents don't understand how much pressure they're putting on them. And it's so true. Like, as I feel like for the clinician, I feel like it's very hard because we are human being, right? We are biased, we'll take our decision from our experience and our training combined, right? But one thing is to kind of understand, as Tori was pointing out, that it's hard to see both points, but we also need to be aware of our counter transparency, like where we are coming from, like what we are seeing. Okay, this is what I'm seeing. This is why I am siding with the daughter. Then the psychiatrist, my senior was siding with the mom. So that's something actually, if you have that insight, that helps always. But it's always hard to being in those conversations because you never know which side to take, and do we even take side, and how do we kind of like facilitate those conversations? Yeah.
Kind of related to that. Yeah, I was gonna say, yeah, all these comments are kind of related. So I really like the depiction of the child psychiatrist where you were able to kind of like find common ground between the daughter and the mom and not try to take sides, but just to try to get both of them to see things from each other's perspective. And that's very difficult to do because often for these teens, when they come in for these sessions, I feel like off the bat already, they feel like the psychiatrist is gonna side with the parents. And so it's just kind of nice to see that depiction. Yeah.
Is there anyone else?
I did have a question I wanted to ask the group that might be a little bit of a tangent. But as I'm starting training and I'm digging a little bit more deeper into like South Asian mental health, one thing that obviously is really well known is the stigma about even getting help. So, and what we're seeing here, it's a situation where you have a psychiatrist or a mental health provider in the picture, which for a lot of people is not the case, that they would even reach out to get that sort of help. And so one thing I've been thinking about is how do we basically provide resources or information on a community level? And I've been trying to figure out how to do that. And I'm wondering if anyone here has any ideas or has started anything in that realm.
So I will share something with you. So this is the chat together. We talk about that one of the resources you can use. They talk about Asian community, and there's another one. I'm going to put the link here. Is Stanford Chico. Both of them are actually using media to your mental health awareness in Asian or minority community, especially Asian community. So I think like that's one of the thing maybe you can look into. But that's why this type of work you like. There is not much of resources out there, to be honest with you. And that's actually one of the reasons I feel inspired to do this kind of event. So that's what I would suggest. And I agree with you. When I was a fellow, and then we had quite a bit of, I had actually 3 or 4 patients from South Asian community, outpatient. And you were right. I see them when they're really, really sick, right? We see them when they're really sick. Usually the South Asian community, they don't seek out mental health. This kind of conversation, when this conflict happen, are not gonna, the mental health, the psychiatrist or the social worker or the mental health therapists are not gonna be the one who is facilitating this discussion, right? That's what the needs for this type of work. We need to kind of like do more of this type of work. And that's why I feel like media is such a good thing, because when you visualize things, then it's a stick with you. Then kind of like going through an article or someone is giving you some points. So this type of thing could be one of the tools. So one of the program is called SleepOwl. Two of my colleagues are doing that. One is Steven Sust. You might, I know you are at Boston, right? So this is Steven Sust. Another is Richard Ha. Both of them are pretty involved, and then of course Dr. MCM. So if you look into their work, you will be able to find at least some of the resources. They have a lot of video. CHIPAL has a lot of video. Chat Together has a lot of video talking about different mental health topics. Yes. And we are trying to also build something specifically for South Asian. Like Chat Together and CHIPAL are more focused on East Asian. So what I'm trying to do with my community to try to build more resources for South Asian. So please, I'm going to drop my email address here. Please feel free to contact with any one of you if you want to kind of like do this kind of work and then kind of get together and then brainstorm and then see how we can work for South Asian mental health. So as we're coming to the end, I want to share, please scan this. We are gathering data just to see that this kind of event is effective or not, and we should do more video like this or not, or what type of video you guys want to know. So let me share my screen so that you can take a picture. Okay. So I'm going to stop sharing, and there's also a link in the chat. Roxana sent it to us. Thank you all for joining. I want to thank you, the actress, Liana and Dr. Ishaq. And thank you, Siva and Tori, for joining me, and all of you for joining and then having this conversation with us. I know you're all busy, but taking 1 hour from your evening, you chose to be here. I'm really appreciative of this. And please, I have dropped my email address here. So please feel free to email me and contact me if you have any question or if you want to be involved in this kind of project. We are trying to expand it. We can use all the help. Even though it's a grant, it's a very small grant, and it's just a pilot program. We are trying to expand the community. Most of the people you see here, they volunteer their time because they're passionate about mental health. They're passionate about Asian mental health, and they are passionate about AAPI community. Our goal is to take this kind of project to school and to the community, so we can show them and we can have open conversation and we can build more and more video and kind of help raise some awareness about mental health among this community. Yeah. Is there any question you guys have or anything anyone else want to say? Okay. Thank you all for joining. And thank you so much, Dr. Wilson, for joining us. We really appreciate your support. You and Dr. DeLucia, both of your support. We couldn't have done that without you. And then also Roxana, who did all this work for this event. I really appreciate this.
Thank you. It's been great. I've learned a lot through the process.
It's been a wonderful learning experience, yes. Okay.